Hello, I'm Christina Clark, a licensed psychologist and assistant professor at Emory University in the School of Medicine.
And my name is Joya Hampton Anderson, and I'm an assistant professor and also a licensed clinical psychologist at Emory School of Medicine. And the title of our recent article is Culturally Humble and Anti-Racist Couple and Family Interventions for African Americans. Anti-Black racism, including structural racism and racism-related disparities, have come to the foreground in recent years with the increasingly frequent and brutal police killings of innocent African Americans, the disproportionate impacts of the pandemic on the Black community, and the effectiveness of the Black Lives Matter movement. There have been calls to action to ensure cultural effectiveness of couples and family therapy for African Americans. As one response to these calls, this article provides 3 recommendations for culturally humble and anti-racist couple and family interventions. The first being embracing a systemic stance and a strengths-based, culturally responsive lens when assessing and intervening with African American couples and families. This looks like considering the multiple interlocking and nested systems, so our schools, neighborhoods, religious organizations, law enforcement agencies, communities, all relevant to and that impinge upon each family system. It is also critical to understand how structural racism impacts all of these factors. This approach also enables couple and family therapists to join with the family to address real-world concerns such as food insecurity, housing problems, healthcare access, and may also involve incorporating community partners and family advocates such as teachers and pastors. Finally, regarding using a culturally responsive lens, the therapist must be able to facilitate conversation about social identities and the intersections between them.
The second best practice focuses on the need for therapists to be intentional about and consistent in engaging in self exploration and taking the necessary steps to be not just competent, but also capable. Cultivating an ongoing and consistent practice of self reflection is an essential component of anti racist practice. This facilitates the couple and family therapist's ability to recognize when they're caught in rigid thinking and prevents them from tolerating the ambiguity that better aids in their ability to understand and support the couple and family with whom they're working. Couple family therapists must amass and intentionally use the knowledge, skills, and attitudes that they have developed to offer culturally sensitive and responsive interventions with humility. The third set of best practices detailed relate to assessing and intervening using a strengths-based approach in a culturally responsive, anti-racist, and socially attuned fashion. This involves prioritizing the therapeutic relationship, embracing a culturally responsive approach to assessment, capitalizing on strengths, and addressing power, equity, and structural racism. The article concludes with recommendations for couple and family therapists to develop a critical consciousness, engage in anti-racist practices, and address oppression while advancing healing and liberation, all of which are essential to ensuring the resilience and well-being of African American couples and families.
And with that, we're happy to answer any questions or engage in any further discussion about this work. Thank you.